Dr. Melillo, thank you so much for coming on to the show.
Oh, it's my pleasure. I'm excited to be here.
Fantastic. I want to dive right into what your thoughts are on the developing brain and why is that so important to know about as far as how that affects our brains, especially as we age?
Sure. Well, because there's a famous quote out there that says, the what happens in the developing brain ultimately is the fate of the adult brain. So all of our brains are developing, and our brains are still creating myelin until we're 50. So you could look at that our brain, although is mostly developing up until our 20s for sure, that it's probably still developing even beyond that. So the idea that when we look at there's 20% of children that have some sort of severe mental health diagnosis in their life, and then there's roughly 20% of adults that have a diagnosis of some sort of mental health diagnosis. I believe that's the same population. So I think that, what we know now is that even most adult mental health issues, they really all start in childhood. And it has to do with not brain injury, but rather just dysfunction, where as the brain's developing, it goes a little off the track. And once that happens, over time, it just gets worse. It doesn't get better. And that leads to most of the issues that I think we see in children and adults.
I got it. I wanted to ask you a little bit more about primitive reflexes. That caught me off guard, and I'd like to know more about that.
Primitive reflexes, I became aware of them over 20 years ago when, in the developmental world, I mean, I've been aware of primitive reflexes, but as far as their role in some sort of neurodevelopmental issue, 20, 30 years ago, I was, being introduced to that. I started using it in my practice, and then I started teaching it into the doctors and therapists that were taking my courses. And what really shocked me was, we didn't have any children at the time to really show or other patients. So I had them test for primitive reflexes on one another. And what I found was that about 30% of the audience still had clear cut classic examples of primitive reflexes. And there was one person in the class that had all of them like textbook, which kind of shocked me because I was, we were talking about they might persist in children, but no one was really talking about that if they don't go away in childhood, that they might never go away and they might even affect adults. And so since then, over the past 20 years, every single lecture I've ever done, whether it's to parents or whether it's to doctors or therapists or adult patients, we test primitive reflexes and we find that again, right now, it's probably mostly about 50% of the audiences. And that in my patient population, I've been checking adults and children for primitive reflexes for most of my career now. And and so, I consider myself probably the world expert on primitive reflexes in adults because no one else checks for it.
Yeah.
And so the interesting thing is primitive reflexes are these foundational reflexes. When we're born, we have to move to build our brain. We have to be able to move through the world to engage our senses so that the sensory feedback can stimulate the brain to grow and also calibrate the brain to the world around us. And we can't really move under our own volition when we're infants. So we have these reflexes that we're born with that mostly come from the brainstem area that allow us to move and interact with the world, that then build the brain, that then allows for more complex movement, that then causes more sensory feedback. And the brain builds from the bottom up. It builds from the bottom of the brainstem. It builds in layers as we move through the world. And then the brain itself, the cortex is built and it comes down and ultimately is the main thing to shut off these reflexes. And all of this should really happen at the foundation of it within the first year. Primitive reflexes are something we've known about neurology and neurodevelopment for over 100 years. They're part of a traditional pediatric neurology exam in infants up to the first year because we know they're supposed to go away at the first year. But the question is, what if they don't go away? What happens? And is that a possibility? And I've proven through my research, which we've been doing extensive research over the past 4 or 5 years just on this topic, that they don't go away sometimes. And when they don't go away, it actually means something and has a big impact on brain development.
Wow, that's fascinating stuff that we would maintain that. And it's like you said, that's a no-no. We don't want that for optimal brain functioning.
Right. And we know that, there's also, we call them retained primitive reflexes when they don't go away, but there's also something called returned primitive reflexes. So when someone has a brain injury or someone has a spinal cord injury, or stroke, or later on in life when they start to have some maybe neurodegeneration, we see that many of these reflexes return. And they are classic signs of brain injury. But we also know that now they may not go away. And that also is not due to injury, but dysfunction or just developmental maturational delays, which is what's happening in most mental health issues and neurobehavioral disorders. There is no injury, there is no damage, there's no pathology, there's no genetic mutation the majority of the time. We're looking at a maturational developmental delay and imbalance, and the degree of that developmental imbalance usually is related to the severity of the problems.
Once again, yeah, I could see how you could go down that so deeply. I wanted to dive into what's going on with the hemispheric integration. And I know that you mentioned that the right brain develops first. Is that correct? And
Yeah.
why is that the case?
Yeah, I saw the picture in the back and I loved it. But yeah, to me, looking at the balance or the development of the hemispheres is critical. It's so important. And really, if you go back throughout neuroscience, we know that, that's been one of the most accepted facts, that, we have localized and lateralized brain functions. For instance, if someone gets a stroke in the left side of their brain, they may have a verbal aphasia or they may not be able to speak. But if it happens on the same area on the right side, that isn't the case. And that's just one example. But what we do know is that human brains are the most lateralized brains. Our right and left brain do different things. And that's really a great advantage. It's really like having two brains in one. Mm-hmm. It's important. It's like, if a bird is actually looking for seeds on the ground, and they need to look at these seeds and be able to determine, is it a seed or a pebble? They need to have really clear, detailed focus, right? So the left side of the brain is detailed focus. But at the same time, the right brain needs to be looking out for any predators or anybody that might be attacking us or any danger that might be coming. So both hemispheres are working at the same time always, but they do different things, or many times the complete opposite things. When one side turns on, the other side may become less. So what we see is that interaction is hugely important. But even with the most advanced imaging, it's very difficult. We can't really see a lot of this happening. Or when we see the brain, we may have both sides of the brain may light up on an fMRI or when we're doing EEG. And they may even have the exact same types of brainwaves, but they're doing completely different things. And I believe that when we look at when you look at any symptoms of any disorder, whether it's, ADHD or autism or schizophrenia or bipolar, and we look at the fact that it's not just mental health, it also affects their body and their immune system and their digestive system, their motor system, how they process sensory information, that the brain regulates everything and the right and left brain regulate things differently. And the only way that many of those disorders make sense, there's a very famous neuroscientist named Tim Brown who had a quote that said, except in light of brain asymmetry, nothing in human psychology or psychiatry makes sense. Meaning when we look at why certain symptoms are there or why people are so good at certain things and so delayed in other things. The only way it makes sense is when you really understand the way the right and left brain work and how that dysfunction can also produce symptoms.
I'm curious, why has that hypothesis, or why has those findings been demonized over time? That, oh, that's an oversimplification, but you're telling me something completely different. So
yeah, I think, way back when it was first really discovered in the 60s, I mean, we've known about brain asymmetry. First of all, we just published a paper out of my lab this year that went back and really talked about the evolution of brain asymmetry, and that we know that it goes back to at least 500 million to 250 million years ago, that animals then, some of the first multicellular animals on the planet, had lateralized brains. So it's been the norm from the very beginning. But when it really was researched in the 60s, it became very popular because it was really fascinating. And so, some people, made certain things or, made certain statements about it and became very popularized. And so some of that was oversimplified. Some of it was a little bit more exaggerated. So, it became, in many circles, it became, even though it was very clear that the brain is lateralized, it really was about personality, that there's a right brain and left brain personality trait, which there is, and that there is absolutely what we call a cognitive style, and there is more of a right brain dominant personality and left brain. But the idea of that is something that some people find an oversimplification. Some people find it, for some reason, to be something they don't like. But mainly, I think it's because the subtleties of that are hard to show. So, for instance, if I did an MRI in your brain, right, or if I even did a functional MRI in your brain or an EEG, none of that would tell me if you're right-handed or left-handed. But are you right-handed or left-handed?
of course, yeah, right-handed.
Right. So that's, most of the population is right-handed. But if we look at your brain in real time, there's no way that we would be able to determine that you're right-handed or left-handed. So we know that the brain, that's being regulated by your brain. We know there's a difference in your right brain and your left brain for dominance, for handedness, and maybe your dominant eye and dominant ear and dominant foot. But we couldn't really see it if we look at it even with the most sophisticated tools. And that's pretty much true for our behavior and the way our brain works, that there are right brain and left brain dominant things, and both sides of the brain are always working. And when there's a problem in the brain, there's a problem on both sides, where one side of the brain may be underactive in a specific network, but that usually leads to overactivity on the other side. And both of them become symptomatic. And as you said, the right brain develops first in the womb and for the first 3 years or so. And then the left brain kicks in, and then the left brain develops. And those subtle differences in development are really what we experience during those times, create specialization in our right brain and our left brain. There are no genes predominantly that cause our right brain or our left brain to be different. There are genes that turn on the right brain more first and then the left. But most of the things that make our right brain do what we do and the left brain do what we do are what we call non-genetic factors, meaning it's mainly based on environmental experiences and what's going on in our brain and what side of the brain is more active first. But the fact that we have asymmetric brains is very, very important. There's no doubt about it. Anybody that says that that's not true just doesn't really know how the brain works. And that's true in general. There are very few people out there, and especially clinicians of any kind, that really, really understand how the brain works in a really functional and detailed way.
Thank you for explaining that. I wanted to ask you, what are some ways that we can synchronize our left and right hemispheres of our brains together?
Yeah. Well, the problem arises is when they aren't synchronized, right? And that's again, when we look at the brain and we look at it from a standpoint of, we really look primarily at networks now, right? What we call large resting networks or different networks. And those networks are made up of different anatomical areas in the brain. And it starts in the brainstem and then works its way up into the brain. And so these networks really start below and kind of end working up. And the networks themselves are lateralized. We have different networks like the default mode network and the salience network and the executive network, the central autonomic network. And these networks are a little bit more right brain or left brain as well. Like the salience network is more related to the right side of the brain and really pays attention and interacts with what we call the ventral attention network, whereas the central executive network is really more the left brain. So we have these networks and they oscillate at certain speeds, right? They're firing at certain rates, and the brain itself and the hemispheres is firing at a certain rate. And we need to be able to coordinate. So really, it comes down to understanding brainwave frequencies. Ultimately, for communication to happen between networks, they need to be on the same frequency band. And what we see is we can measure that with EEG or QEEG, and we can see what's happening. And we have different frequency bands going from 0 up to 100 at least, as far as our Hertz frequency. And we have names like delta and theta and alpha and beta and gamma, but they need to really be synchronized together. And what happens is that the speed of those networks is a developmental process. The brain waves, we start out with very slow brain waves in our brain. And then as we mature, our brain waves become faster, they become more synchronized. We're able to get more and more areas of our brain to fire at the same time. And then we also have to be able to get both sides of the brain or networks on both sides of the brain to fire instantaneously together. The human brain especially is the fastest and most efficient brain on the planet. It's also relatively the biggest one. And so coordinating all that together, anything that's slow or inefficient or that slows down the brain or makes the brain less efficient is going to have an impact on behavior. It's going to have an impact on function. And so we need to be able to coordinate and synchronize. When we have maturational imbalances where certain networks are maturing at a different speed, it prevents the networks from synchronizing and coordinating. And we see that certain areas of the brain are staying very slow, not because they're damaged, but because they're very immature. Other areas then may speed up and they become faster than they might normally be for that age. And those frequency bands don't synchronize. So the way that we have to synchronize the brain is by activating one side of the brain more and speeding it up and slowing down the other side, right? So synchronizing the brain, normally that should happen. Normally, as we're developing and as we're working, that can happen. And there are things that can make it happen better. It's been shown that things like meditation or other types of practices like that helps the brain to synchronize. It's been shown that, like, for instance, Tibetan monks are able to synchronize their whole brain in a gamma rhythm, and that's unique, right? And that's kind of like the ultimate. But more importantly, the problem is that if we don't have a synchronized brain, and most commonly it's networks from the right and left that can't coordinate, we have to activate one side and cause it to grow and get faster. And we may need to slow down the other side so that we can get them to match.
Beautifully explained. I found that meditation for me was, I ultimately said meditation saved my life because I had experienced a pretty bad brain injury. I had brain surgery, epilepsy because there was a cavernous malformation in my left frontal lobe. And I was out of my wits, brain fog, symptoms, you name it, of having about 3 grand mal seizures a month. And of course, nutrition helped, but ultimately, I feel that meditation was what allowed me to create neuroplasticity and be able to process information better. Would that be accurate?
Yeah, yeah. I mean, there's some really good research out there that talk about meditation, and that, again, neuroplasticity, and then it can literally physically and functionally change the structure of the brain.
Mm-hmm.
When it tends to be a little bit more global in its effect when we're doing it.
Mm-hmm.
So what can be added to that is, if when you have a brain injury, you may have a global brain injury, which means both sides are injured. Brain fog may be more related to more nutritional or oxygen or inflammatory chemicals affecting your brain. But if you have specific functional deficits or overactivity that lead to symptoms like OCD or tics, or what we call stims in autism, or anxiety or depression, or specific functional deficits that may happen, then we need to do specific directed brain stimulation to activate it. Just like if you had a damaged part of your body, if
Mm-hmm.
you your right arm, doing aerobic exercise helps your whole body get healthier, but it's not going to specifically target the injury in your right arm, right?
Got it.
So
Yeah.
meditation is more like doing aerobic activity and like running, which is good for your brain and your body in general. But you also need to address any specific injured areas of your brain or areas of your body. So you may need to do targeted exercise to strengthen, muscles on one side or the other, or you might need to stretch and reduce hyperspasticity, or of some muscles on one side. You may increase the tone on one and decrease the tone on the other to create more of a balance in your body. And that's what we need to do in the brain. So there's a lot of great activities. Like you said, nutrition, bionutritional, biomedical treatments are good. Oxygen, hyperbaric oxygen, other things like stem cells, all of those things can have its place and can be beneficial. But if you're not doing targeted and directed stimulation to the brain, then that is really what needs to be done, especially if there's specific areas that are dysfunctional or injured.
Fantastic. I wanted to ask you a little bit about the social media and video game brain that's such a thing these days. I feel like ADHD numbers are at all-time highs. And what are your thoughts? What's going on in like the social media and video game brain where the dopamine levels are just skyrocketing? It can't be good, right?
No, and I talk about this in my book, Disconnected Kids, and going back, I was kind of witness to that when this whole kind of epidemic rise of ADHD and many other disorders really started happening, which we really started becoming aware of them in like the late 80s, and started to see the beginning of this wave. And I believe that it really started primarily with the advent of computer technology and with changes. I mean, the biggest shift in our society, I think, that's ever happened in history has been our shift towards this technology world now, where we've become very sedentary, more and more. Physically, where we go outside less, we don't move as much. And this is affecting younger and younger and younger and younger ages. I was just at an airport coming back from Australia the other day, and I saw this little child. He was maybe 2 years old, and he was just sitting there, mesmerized, stuck in front of an iPad. And he was there for at least an hour and a half that I saw it, right? And he didn't move, he didn't do anything. He was just mesmerized. Now, that's not natural for a 2-year-old child. A 2-year-old child should have been moving around, exploring, jumping on everything and all of that. And the father or the mother should be following them around and trying. And that's harder, of course, right? It's harder. But what should happen is that baby should have this drive to move.
Mm-hmm.
The right brain in the beginning, in the first 3 years, movement is what builds our brain. The video games and most video technology and social media is really directed towards the left side of the brain. And the left side of the brain is more dopaminergic. And the left side of the brain is more the addictive, obsessive, compulsive side of our brain that likes to do the same thing over and over. Ian McGilchrist, I don't know if you know who he is, but he's a very well-known psychiatrist out of the UK. He's written several books over the past few years, and it's all about brain asymmetry, right? And his book, the first book called The Master and His Emissary, it's a 700-page book about what's happening to the mental health of the world and looking at right and left brain asymmetry. And he talks about, and he uses many of the same references that I used in my textbook about how we've been moving, over the past couple of 100 years, but especially lately towards a left brain world. Yes. And everything is moving towards a left brain, and the right brain should be the master of the brain. Through most of human history, the right brain has been dominant. The right brain is about building relationships first and foremost, maintaining social relationships, and being able to read nonverbal cues. It's about living in the real world. It's about nature. It's about our environment. It's about compassion. The right brain is moral. The right brain is ethical. The right brain is spiritual. The right brain is connected to our own body and our own feelings, and then connects to other people and their feelings, and sees the big picture and sees the context of things. The left brain is individualistic. It's ego-driven. The left brain only cares really about itself, and it's goal-directed. So it has a specific goal, and that's all it cares about. It likes to do the same thing over and over and over. It doesn't like to be taken out of our routines. It's not connected to other people. It's not connected to our body. It's not connected to the real world. It wants to live in a virtual world, an imaginary world, this world in the computer system. And the only emotion that really is purely left brain that the right brain can't do is anger. And so we see that we've been moving in a world, and politically and everything, where we're more isolated, we're more separated, we're more angry, we're more fighting with one another, we're less connected to people, we're less connected to the environment and the world around us. And I believe that this is driving most of the mental health issues that we see. And ADHD is just one clear example of a right brain delay with overactive left hemisphere. And I believe our computers are driving us that way. And especially when we have children, 1 and 2 years old, who shouldn't be even seeing a computer, we shouldn't even have a left brain yet. And what we see is that in autism and ADHD, and their left brain comes online way too early, and they don't develop that right side of the brain.
I love that. I love that so much. In autism, when you spoke about it, I got chills, because you were talking about how autism really is an overactive left brain, but that there's a lot of genius component to that, and absolutely fascinating. Can you speak about that?
Sure. I always say, this is what I work with more than anything else. This is my area of research more than anything else, is really looking at autism spectrum, and especially non-speaking autism, and trying to really understand that brain. And what I'm convinced of, and what I think we've proven, is that every person who has an autism diagnosis, and the more severely impaired they are, the more true this is, the more left brain geniuses they are. They are left brain geniuses. We know that autism, like most mental health issues, is not based on a genetic mutation. There's no single genetic mutation that is responsible for any mental health issue. So that's a misconception that people have. And we know that with certain disorders like autism, we say there's an autism trait. Only virtually very few, if any, parents of kids with autism are actually diagnosed themselves with autism. Only about 19% of siblings of kids with autism also have an autism diagnosis. So the vast majority, 80 to 90% of other family members do not have a diagnosis of autism, but they have traits of autism. It's a personality trait, right? And so what we see is that basically in the family, it's a left brain dominant trait. So Simon Baron-Cohen out of the UK, who's a famous autism researcher, has written a number of papers on how there's a greater amount of mathematicians, physicists, and scientists and engineers in the families of people with autism. We know that anywhere in the world that there's a cluster of people that work in the IT industry, that there's a spike of especially high functioning autism. Silicon Valley has the highest percentage of autism in the world. It's about 1 in 5 kids now there have autism. And so again, it comes from the fact that the left brain is highly intellectual. It can also be looked at as an intellect gene, right? And so these are people that naturally are very good in school, academically, good in math, good in science, have really good memory for details and facts, do well academically, and that's a trait. And their right brain may lag behind. They might not be the most social people. They might be, a little bit what we call, like, it's also referred to as a geek trait, right? So they may be a little bit geeky or nerdy, which is a good thing. I mean that in a good way. Yeah. And now if you take that trait and you bring it a little bit further along where it's a stronger version of that trait, what happens is you go off what's called a cliff edge. And now that trait that makes us better and stronger and fast and smarter now creates a disability. The example that I use is from an article that I read a while back called the Puzzle of the Unbalanced Mind in Psychology Today. And they were talking about how, most of these issues like schizophrenia, bipolar, autism, ADHD, that there are certain traits, but they don't necessarily always give great advantages. At some levels, if it's real severe, we know that the majority of people with autism don't have their own children. We know that the majority of people with schizophrenia don't have their own children. We know that the majority of people with bipolar disorder commit suicide 5 times more than the average person. So from a passing on your gene standpoint, those disorders seem to lower your ability to procreate and pass on genes, but yet we see them actually increasing in society. So it means that at one level of the gene, of the trait, it gives great advantage. But you go too far, and now it becomes you have all these vulnerabilities.
Kind of like getting too close to a cliff or something.
Exactly. So the example is like if you want to breed for faster racehorses, you would breed animals that have longer and thinner legs, right? So they have longer and thinner legs, which makes them faster. And so if you keep on breeding them for longer and thinner legs, you get faster and faster and faster animals until their legs become too long and too thin and they break very easily.
Oh, wow.
Right. And now that becomes that trait, which was a great trait for speed, now becomes a trait that becomes a vulnerability and ultimately a disability that doesn't allow the horse to really perform well and may actually, shorten their life. So that's how traits work. They get stronger and stronger. They give advantages, but as they give advantages, they also give us deficits and vulnerabilities. And at a certain point, the deficit outweighs the strength. And that's what we see in autism. But that strength is this left hemisphere genius level skill. And it's amazing. But, if it gets too much, then it may actually prevent their right brain from developing. And it may really disconnect from their body, affect their social development, and ultimately even affect their ability to speak.
Elon Musk comes to my mind a little bit because I watch him on podcasts or video, and he seems like he's not all there. Absolutely brilliant, but he's not all there socially. Is that something that you see as well?
Yeah, I think so. I mean, I think he's a very, obviously we know he's a very bright guy. We know he was a brilliant student. He was a genius academic. And obviously he's been able to translate into pretty good business success. But he does have some social skills. He's an example of, I think, a clear left brain dominant personality, but somebody who also can do social skills and, at a certain level, maybe not as much as somebody else, but he's somebody who clearly has a left brain dominant trait, but is a pretty balanced guy. Like Einstein. Einstein was more of a right brain genius. Einstein obviously had genius level skills and could see things, but was also very social. But he also, was pretty good in math and science. So you see people that are certain geniuses that are functioning, that really function well in the world.
Yeah.
There are other geniuses that, may function well at one end of it. Like, that movie, The Beautiful Mind of John Nash, right? He was a brilliant mathematician, but he was so schizophrenic that he couldn't, and his son was schizophrenic as well. And the same thing, went to Harvard. You get a guy like Isaac Newton, who was a genius with his left brain, but really socially was very inept and, had a lot of issues. So, we can see genius, and we see that, the idea of having a stronger left or right brain can be a great advantage. People who are right brain, who are artistic or creative or very social or very inventive, they may also be dyslexic, like Thomas Edison was horribly dyslexic. Ed Sheeran is very dyslexic. A good friend of mine, Zach Brown, is very dyslexic. My daughter, who's a phenomenal musician and singer-songwriter, was borderline dyslexic. Many great athletes I've worked with have been dyslexic or bipolar. So what we see is that with the great gifts comes vulnerabilities. But I think Elon Musk is that personality trait that might be looked at as an autism trait, but he's obviously very highly functioning and also can do right brain skills pretty well.
Very well explained. I wanted to transition a little bit to stress and the brain and how that kind of interferes with our brain's ability to communicate. Can you speak upon that?
Sure. Well, stress, first of all, we have to define what that means. There's the stress response, the physiological stress response. And what we see is that we have two parts of our autonomic nervous system, the sympathetic, which is really where our stress response or fight or flight response comes from. And then we have the parasympathetic, which is our rest and digest and repair system, which lowers the stress response. The stress response tends to increase inflammation in our body and is pro-inflammatory, which is important when we have an injury. If you have a brain injury or something, you have to have inflammation, but inflammation is also destructive to our body and to our brain and our tissues. So then the parasympathetic nervous system needs to kick in, which is more the anti-inflammatory. That helps to calm down inflammation and helps us to repair our body. If we have stress around us in our life, if we have a stressful life, that may increase our fight or flight, or our sympathetic nervous system may increase inflammation in our body. But more importantly is that if we have imbalances in our brain on either side, or if we don't really develop our brain, ultimately when we're born, we're naturally in a sympathetically dominant state. Over the first year of life, we should develop the more higher level parasympathetic nervous system, and then the parasympathetic and should be in balance with one another. If we're in danger, if we need to run away or fight, or we have an injury and we need inflammation, the sympathetic nervous system should kick in, and then the parasympathetic should kick in after it and let us calm down and lower our heart rate and our blood pressure and allow us to digest. But if we're constantly in a state where the sympathetic nervous system is high and the parasympathetic doesn't develop, then chronic stress responses in our body are really devastating to our body and to our brain, and can cause real damage to both, promote inflammation, and can even promote kind of a splitting of the two brains, and so that they can't really communicate with one another, which is what often happens during psychological trauma.
Would it be a stretch to say that the left brain primarily activates our sympathetic system and then vice versa? The right is for our parasympathetic system?
Yeah, I believe so. I think, it's in the literature, there's some literature that says the opposite of that. But I think, again, if you really understand the way the brain develop and the way they work, in particular, there's an area of the right side of the brain called the insula cortex. And we have a left and right insula, but the right insula is where the final processing. And this is what really connects us to our body initially. And that side of the brain is really connected to, it develops self-awareness. It allows us, when we're around 18 months to 2 years, to really become self-aware or embodied, or what we call body ownership. It also regulates things like taste and smell. It's where we perceive pain. It's where we have something called interoception, where we really connect to our body and we feel things like pain and hunger and thirst and temperature, and when we're tired, and when we have to go to the bathroom, and when we're fatigued. And what we see is that area of the brain is very, very underdeveloped in people with right hemisphere delay syndromes like autism. They may have very high pain threshold. They may not really feel pain, hunger, or thirst, or temperature at the same level. They're very disconnected from their body. And we see that their parasympathetic nervous system is very underdeveloped, and their sympathetic nervous system is always on. They're always on high alert. And this affects their digestive system and their ability to sleep and all of that. And we've proven all of this with research, by the way.
Fantastic. Do you have the children that you work with work on breathing patterns, or any of the older patients that you may have to help regulate that?
Yeah, as they get older, if we can, but to try to get a child, let's say, that's non-speaking autistic, to try to do breathing exercises doesn't work, right? So what we need to do is we need to do things that are going to change their brain. Once you gain ownership of your body, then you can develop agency. So when at 3 years old, when the left brain kicks in, we start to get now control of our body and our actions and our movements. And we can start to do things more volitionally under our own control. But you have to gain ownership of your body and your brain first with the right brain. So if the right brain is delayed, the left brain agency, this is where we see, these tics or stims or stereotypical movements or behaviors like flapping or rocking or running back and forth or making noises. You can look at a child with autism and realize they don't have control of their body. So try to get them to do breathing exercises isn't going to happen. Now, if we're working with an older kid or an adult that has some volitional control, then breathing exercises or meditation practices or things like that can be really good, or getting them to do aerobic activity where we really force them to breathe at a higher level is also very helpful. But, we need to be able to stimulate their brain and get rid of those primitive reflexes, which we've found is retained in all of these conditions. And that's the bottom line. That's always going to be holding back the brain. As we said, the right brain is developing first. At 1 year, these reflexes should go away. If they don't go away, they literally hold back or slow down brain development, especially on that right side. If you get someone that's a left brain genius, it may come online too early. And we have kids that at less than 2 years of age, even some kids below 1 year, can read, right? And you shouldn't be able to read until well after 3 years of age with your left brain. We shouldn't form conscious memories before the age of 3. We have many kids on the autism spectrum that are verbal and can tell us that they remember when they were 1 year of age. So when these left brain skills come online too early, then that further holds back that right brain development. And this sets up this imbalance that only feeds off itself. And then during growth spurts, that imbalance may become worse. And that's often when we see regressions, when kids may have seemed to be developing typically or may have been starting to speak, and then all of a sudden they crash around the age of 2. They crash, they lose a lot of those skills because of that imbalance becomes more severe. And when they go through these growth spurts, the imbalance tends to become worse, not better. And this is how we often see that many of these issues develop.
Very interesting. When you talk about primitive reflexes, what comes to my mind are animals and the trauma response, because it seems like my dog knows how to breathe better and regulate itself better than the majority of the population, unfortunately, out when I go out on the street. People's breathing patterns are very erratic. I wonder what's going on there, you know?
Everything comes down to the brain, everything, meaning that we don't realize that, our brain is supposed to control everything. And most of it is subconscious. And most things that are subconscious are mostly controlled by the right brain. The right brain controls most things that are conscious. The left brain controls things that are conscious. But what we see is that there are different inspiration and expiration centers in the brainstem that ultimately fall under control of the brain. And what we see is that if there's any dysfunction, whether it's in our digestive system, whether it's in our hormone system, whether it's in our immune system, whether it's in our body, our muscle tone, it's always a problem that really starts first in the brain and the brainstem. And so you're right. Many people have dysregulated breathing because, again, a lot of it comes down to this sympathetic and parasympathetic system. When we're fighting or running away, we breathe in a certain way, right? We have maybe short, shallow breaths, mostly from our upper chest. When we're in a parasympathetic state, we have long, slow breaths that mainly are deeper and down in our belly and our diaphragm. And we know that, that's regulated by different signals that are in our brain and our brainstem. And so if we don't inhibit, if our brain doesn't mature, and if our parasympathetic vagal system doesn't kick in, we tend to have really shallow breaths and we can hyperventilate and have a lot of issues that way. And like you said, animals don't have the intellect that we have, but they don't have the vulnerabilities that we have. If our brain doesn't work and doesn't develop in the most optimal way, we have consequences of that. Whereas animals aren't as dependent on that. Their brain isn't as complex and it's not as vulnerable as our brains are.
That's so many aha moments there for me. I wanted to ask you about what is the Melillo method, and who is the general population that you tend to work with?
Yeah, the Melillo Method is basically, an evolution of my work, and it's the highest evolution. I've been in practice for over 30 years, and I've been really looking at this and doing research since the beginning. I've really been trying to understand the brain and behavior and how it interacts with the body. And I've been doing functional medicine. I'm one of the developers of a field called functional neurology. And now what we look at is functional developmental neuroimmunology. I think the future is really looking to how the autonomic system and how the brain and the immune system really work together. That's really where a lot of my research is going now, to understand that at the highest level, how it affects inflammation and how it affects anti-inflammation and chemicals. And so the Melillo Method is really the evolution of my work, where we use the most cutting edge tools, but it's about understanding what is actually happening in the brain. That's what it starts with. first thing I ask parents or patients when they come in with a complaint is I say, has anybody tried to explain to you what's actually happening in your brain? And the answer is almost always no, not at all. So for me, that's where it starts. We need to understand functionally what's happening in the brain. Where are your symptoms coming from in all areas, looking at the whole body, but also looking at it from a developmental perspective. If even someone that comes in with a brain injury that has a clear-cut injury, I'm still going to look at them and say, well, what was your brain like before the injury, right? Did you have anything that, previous? Did you have a history of something, whether it was a learning disability or a memory issue, or whether it was ADHD? Were you unusually gifted in certain things? So I'm looking at the development of the brain and how over the course of the life it affects you and how that's related to these symptoms. And again, looking at the primitive reflexes, looking at development, and then looking how the brain and the networks and the hemispheres interact with one another and how that impacts everything. And then having a systematic way of working with any condition, no matter what age the child or the adult is, if they have these functional developmental imbalances, we develop a plan of how to combine sensory and motor-based interactions, different types of cutting-edge tools that can stimulate the brain on one side and inhibit the other, like using laser techniques or using transcranial direct current or transcranial electrical current or transcranial magnetic current, or using things like TENS units or neurofeedback or EEGs, being able to functionally measure the brain and looking at the brain functionally, not just looking for organic injury or illness, and looking at how we can get the brain to communicate and reconnect in a way, and look at, diet and nutrition, looking at cognitive skills, and we look at everything, but it's all directed towards this model of understanding what is the nature of the problem. And it's almost always some sort of functional disconnection between networks and between the hemispheres, where one side is underactive and the other side tends to be overactive. And both sides are dysfunctioning, both sides are producing symptoms, and we need to understand how to target and activate areas on one side and inhibit the other, and support it all with diet and nutrition in the most appropriate way.
Thank you so much for coming on, Doctor. I want to ask you, where can people reach out to you? Where's your website, and what do you offer there?
Okay, well, thank you again for having me on. drrobertmelillo.com is my website. At Dr. Robert Melillo is my Instagram. I have a really active Instagram page where I'm always trying to put things out there that educate parents and patients. And you can hear from my patient population. If we have a new paper, we'll publish close to, I think, 10 papers this year alone in research. So my lab, we're actively involved. Everything that I've talked about, we've done the research and have pretty much proven it to be true. And I have a number of best-selling books. Disconnected Kids is my first and most prominent book. We're coming out with a third edition next year, and it's published by Penguin, which is the largest publisher in the world. And also I have Reconnected Kids. We have Autism, the Scientific Truth. Then we have Disconnected Kids, Diet and Nutrition Plan. And I have another book called Einstein's Desk that's out there. All of them are meant to educate and give parents and patients and clinicians tools on how to use that. If they want to get in touch with me, they can reach out through my website. They can go to info@drrobertmelillo.com. And they can reach out, and like I said, I also do respond to DMs in my Instagram account a lot. And I am currently teaching, my highest level course in New York at the TWA Hotel at JFK. It's a really cool hotel. So the next module is in January. That course, when it's done, it will be available online. We have many doctors around the world that have been trained in the Melillo Method and are certified. And this is a high-level fellowship certification course. So again, if anybody wants information on that, they can go to my website. And we have a lot of videos. Also, my wife and I have a web series called Disconnected Kids, Reconnected Families. It's on a new streaming network called Your Home TV. We're actually #1 show on that network. And we've had 2.5 million views in just 6 months on that show. So it's a web series where we go into the home, my wife and I, we go into the home of some of the kids and families that we work with, and we work with them at home on how to be able to do exercises or their diet or their nutrition or how they do exercises or even, relationships or parenting tips. And we have 2 seasons, and again, it's been on this new network that is really gaining. It's in 118 countries now around the world. It's on Roku. And since the very beginning, we've been the #1 show on the network. So it's a really cool show to watch for people and really gives them a window into what we do. And we may be doing another season soon. And we're going to be putting more content up on my channel on that station. So they can find out all that information again on my website or on my Instagram.
Wonderful, Doctor. Thanks again so much for coming on. Thanks for everybody that listened. Can you leave us with maybe some last words here for anybody that's struggling with mental health right now? What is a quick thing you can say to them?
Well, in most cases, it's you always have to consider the neurology. Most people are led to believe that most things are purely psychological or psychiatric, which kind of gives you the impression that it's your fault or that you just think better in a different way. What most people need to read is that most mental health issues are neurological. They start in childhood. They're physical, they're biological, and they're real, and we can change them, and they're not your fault. Meaning that if it happened when you were a child, it's not something that you happened, and that the most gifted people are the ones that are more prone to these imbalances. So people that are very gifted or that really have a lot to offer this world may be the ones that are at most vulnerable and most risk of having imbalances. But any imbalance out there can be changed and it can be helped, but you need to find the proper approach. And, most of the cases, you need to find somebody that really knows how to assess and activate and stimulate the brain in the most appropriate way and look at the diet and nutrition. But that's secondary most of the time to looking at the function of the brain itself. So that always have hope. I work with the most severe issues. And if you come in my office, there's a sign that says hope lives here. Because many people, their hope is taken away. They're told that you just have to live with this, that this is a lifelong problem that you can't get rid of. And in most cases, that simply is not true.
Beautifully said. Thank you so much. Everybody have a fantastic day.
Okay, my pleasure. Thank you.
Thank you.